First of all, I thank you, the Minister of Health, for inviting me to share some of my journey along with the Ministry to set up a National Medical College network. A lot of things has been shared in front and beyond the scope of the presentation by our previous speakers, where it's highlighted the need for e-learning and the need for capacity building through e-learning. I'll just show this slide. I mean, it may be familiar to many of you. There's a projection of population growth which shows that by the 2100, we will have a population where 50% of the growth is going to be limited to these 9 countries, and all of them are very densely populated, and all of them are the low and middle income countries, where institutional-based capacity building is not going to be possible. If you talk of the workforce crisis, if you take a WHO classification, 83 countries are below this threshold. This is the famous Lancet Commission, which has highlighted this need for capacity building, especially addressing to developing countries. So how we should meet out those requirements. There is not only shortage, but there is inequity. In addition to the lack of medicines and supplies, the restrictive policies, I'll focus only on the 3 highlighted points in the red, which can be addressed to the e-learning. That is, failure to update health workers' skills and knowledge, poor management and lack of regular and supportive supervision, lack of key skills such as human resource, financial and program management. All these things can be addressed through distant learning methods. So what should be the best models for especially addressing the low and middle income countries? Hence, long-term engagement needed, which may not be possible with a conventional way. Innovative ideas need to be applied to meet the skill gap using available resources. Many of us are practicing these distant learning modules, as highlighted in these slides. In many institutions in India, for the last 2 decades, we have been doing in silos, and all those things are yielding very good result. And all these examples has led for the ministry to think of integrating all these ideas to make a National Medical College network. So some of the glimpses I'm giving you, some activities have been going on in our country over the last 2 decades. Is already, you can see here from the pictures, are self-explanatory. And all kinds of modules and all kinds of ecosystem has been created, integrating your workplaces, integrating skill areas to the educational network. Some institutions has gone into developing a network for knowledge engineering, and some institutions have gone to create knowledge park. So all these examples has led to the Ministry of Health to decide about integrated e-learning platform, where in the phase 1, 50 government medical colleges across the country has been identified where infrastructure has been created, taking the backbone as a national knowledge network, a high-speed internet backbone, which provide tele-CME, tele-specialist consultation, and access to digital library, etc. Now, in this architecture, we have developed 7 resource centers across different regions of the country and 1 national resource center. And all these resource centers are being selected based on their credibility of educational institutes of eminence, and they have been given the responsibility to mentor the medical colleges in that 5 states in that region, 4 or 5 states, depending on the size of that region. Now here you can see in the right side of the slides, these are the resource centers in the first column and medical colleges attached to that and the state that has been given to them. You have 29 states and union territories. At a particular time, if 50 medical colleges connected, around 7,500 students can be online at any point of time. And we have placed a video bridge in the National Resource Center in Lucknow, which can simultaneously connect to 50 centers in an interactive way and an unlimited number in a streaming way. See, some of these pictures I have taken from the archive to show you how actively this has been going on. 15th of January this month it was launched, and since then all of them are just trying it and playing whatever they want to do there in their own structures. And this is the National Medical College Network portal, where you have a dashboard to give a daily update what is happening and which resource center is having how many sessions. The outcome that we envisage is create good quality content that has been spoken to by previous speakers. Good quality content has to come from eminent professors from these leading institutions, and these contents can be put in the national servers, where anytime, anywhere, it can be accessed to the students. And many of our medical colleges have Wi-Fi campus provided by the National Knowledge Network. We can demonstrate surgery and any live medical procedures for skill development, and there is advantage in terms of flexible education imparting again. Distribute the education uniformly, more efficiency and high education standards to the students and teaching staff, reducing the cost of educational process. This is one of the scenario where many medical colleges are connected at the same time. They're very innovative and they inform all the partners to join same time and they transmit whatever lectures they are supposed to transmit. Some of the visiting professors visit the institutes, they also transmit those lectures. So see this slide here, it's a kind of umbrella structure where the National Medical Network scheme is currently in the 50 medical colleges, and phase-wise we are going to expand to other medical colleges. And the three pillars that we're going to have is that the services. To start with, we are taking up the CMEs, teleconsultation services and teleradiology services. Later on, we are going to have the pan-India coverage where downward integration will be there to the health and wellness centers, which has been already spoken in the morning, and connecting many state medical colleges down below to the district hospitals, CSC and PSCs, and many of the aspirational districts that identify the government and many of these ground level health workers, including the IUs in the alternate medicine pathways. Ultimate vision of the ministry is to go for a platform like a MOOC or edX where live lectures can be delivered, online medical education, certificate question courses has been spoken to by previous speakers, training modules, information dissemination platform will provide one and all these facilities. One thing I would like to say that e-learning is a neutral technology. We have to adapt it as per our need. So I suggest that you identify the problem and address on that. This is one of the examples that I want to show that where one of the medical colleges has been identified to develop one of the subspecialty, and we got engaged with them for 7 years, and we developed a subspecialty there with the mentoring process, and that really became an example and appreciated by the peer-reviewed journals. So what is the vision of the ministry way forward? The National Consultation on a Design Framework for E-Learning that will be held in this month is to be held I think next month. Schedule-based collaborative learning program will be deployed. Web-based learning system in the line of edX will be in place. Design and develop innovative learning modules. National level archive for medical learning material. Electronic books and journals to the students and researchers in due course. Integration of the NMCN with national programs like Collab BDS, Health Access at aspirational districts, My Health Record, Ayushman Bharat will be taken up in the due course of time. So thank you very much for your kind attention.
Thank you, Dr. Mishra. Thank you very much. I think the last two speakers have highlighted the issues that are there in India and the way forward. Dr. Yadav did suggest a number of solutions, including the National School of E-Learning and a state-wise approach. Dr. Mishra has shown you what is going on as far as the National Medical Network, Knowledge Network is concerned, and how there is an attempt to network with medical colleges and be able to use the e-platform as far as training in medical colleges is concerned. We've had a number of speakers with